Hey guys, it's Dr. Mona Gohara. Welcome to another episode of Dear Derm. Today we're going to be talking about body acne, which may be acne or something else. But either way, you'll get some answers. There are two main causes of body acne, one of which is the same type of mechanism that causes acne on your face. You know, the good old hormonal surge that causes increased oil production and then skin cells to shed, clog the pores. So that is one way. The second way is something a little bit fancier called acne mechanica, which comes from friction, pressure, or rubbing. And that creates inflammation in the form of acne in the follicle as well. Then there's another category of body acne doppelgangers. Sometimes you can get bumps that look like pimples, but they're not. They actually can be inflamed hair follicles that come from too much pressure, sweat, or tight-fitting clothing. If you have body acne on your chest and back, that's called truncal acne because it's on your trunk, right? Now, my personal favorite way to treat truncal acne is a wash. Why do I like washes? Because we all get in the shower at some point, and so it increases compliance. Using a simple benzoyl peroxide wash, 2.5 or 5%, one of my favorites is Panoxyl, and just putting it fingertip to fingertip, no reason to overdo it, rubbing it on the chest and back, leaving it on for a minute, and then washing it off can make a huge difference and alleviate a lot of truncal acne. Two caveats. Number one, remember, benzoyl peroxide has peroxide in it, so it can be irritating. That's why I want you to just use fingertip to fingertip, not so much. And number two, the peroxide can bleach. So use an old towel you just don't care about. Another one of my favorite alpha hydroxy acids is glycolic acid, and a great choice for a wash if you're struggling with truncal acne. The Glytone Exfoliating Body Wash, which is 8.8% glycolic acid, is an awesome choice. It's light, not irritating, and a good way to unclog those pores. So if you really want to save, check out Mario Badescu's AHA Exfoliating Body Wash. It's only $8 and can get the job done. So another alternative both to wash and benzoyl peroxide are using pads with salicylic acid on them. Everybody has their favorites and everybody has their preferences. I'm a huge fan of pads and salicylic acid because it helps to cut through those oils and get to the pores that are clogged. First Aid Beauty has a great pad that actually has white clay in it too. I like white clay because it pulls out impurities, so it's an added benefit. And it's a perfect thing to just do in the morning or before you go to bed at night to get rid of that truncal acne. Another great place to use a pad is when you've finished working out and you just don't have enough time to shower. Just grab one of those pads and a quick swab, you're good to go. So another cause of truncal acne is something called acne mechanica, a long and fancy way of saying just some type of pressure or mechanical irritation on the skin creating pimples. The classic example is athletic pads, but also things as simple as a sports bra can do it. It's the friction and the rubbing that creates inflamed pimples. Now, the best way to alleviate acne mechanica is obviously to get rid of whatever is causing the friction. But I personally can't work out without a sports bra on, so that ain't happening, right? So same treatment then converges with use of either a benzoyl peroxide wash or a salicylic acid pad or even a glycolic pad just to help to clear out those pores and decrease the inflammation. When we talk about treatment of body acne, we have to mention retinoids. Retinoids, which are vitamin A derivatives, are really the gold standard for treating any type of acne on your body. There are some great over-the-counter options, one of which is the Roche-Posay Effaclar Duo, and the other is Differin, which is a retinoid gel, medium potency, and all you need is a pea-size amount on the chest and a pea-size amount on the back. You may just need somebody to help you apply it because it's a little tricky to get back there. If topical over-the-counter treatments aren't cutting it for truncal acne, definitely go see your board-certified dermatologist because there are certainly other stronger medications such as retinoids that are prescription strength and even oral medications that can make a big difference and that can make it go away. And to add on to that, A visit to your dermatologist may reveal that it's not acne at all. So one of the most common things that my patients come in for, and it can be very distressing, are pimple-like lesions on the butt, or butt knee. But it ain't butt knee at all, actually. It's actually an inflamed hair follicle. These aren't true pimples. If we're really kind of geeking it out and being true to our science, they're not true pimples. They're inflamed hair follicles. What do they come from? Well, most of the time, I hate to burst everybody's bubble, including my own, but it's athleisure. It's tight-fitting pants made of Lycra that, creates pressure on the follicle and makes it mad and makes it inflamed, or sitting too long, or sweating too much and not changing your clothes. All this stuff can create inflammation of the follicle on the behind and a lot of stress. It creates a lot of stress for people. So one may choose the path of using a benzoyl peroxide wash. That's cool, that's fine, but that may not cut it. You may actually have to go to your board-certified dermatologist and get a topical antibiotic. One's called clindamycin. It comes in lotion, solution, pads, or even an oral medication. Sometimes it requires an oral medication to bring down those pimples, but it may be worth it to keep your athleisure. When it comes to body acne, it's really important to also examine what you're putting on your body. First and foremost, let's talk washes. Keep it simple. A gentle cleanser, pH neutral, non-soap that is light, foamy, airy, just to help to get rid of the day's grime on your skin. Doesn't have to be fancy, no bells and whistles. Second is sunscreen. Now, us dermatologists, we can't stop talking about how important it is to put sunscreen on, and we believe that. But when it comes to body acne, we want you to choose a little bit more wisely. I personally like titanium dioxide or zinc oxide products that are very, very light. Some of them even have the word light in the name. For example, La Roche-Posay Ultra Light Mineral Fluid. It has all the right components in it. It's ultra light and it's a mineral sunscreen. This is much less likely to irritate any body acne. And lastly, if you have body acne, consider moisturizing with a lighter lotion as opposed to heavier creams. Lotions are primarily water, less percentage oil, versus creams are more oil and less water. So don't forego moisturizing altogether, just stick with a lighter lotion. A great choice for a light body lotion is Drunk Elephant Sili Body Lotion. One of the things you want to think about if you have truncal acne is what kind of shampoo and conditioner you're using. I would never give up my shampoo or conditioner. I'm completely obsessed with it. That being said, you may want to think about how you're rinsing it off your body. So make sure that you don't do it down your back like this. Instead, take your hair to the side so that the excess water just goes directly into the shower. Thank you so much for watching another episode of Dear Derm. Be sure to leave any questions or comments you have below, and don't forget to subscribe to Well+Good. See you later, guys.